Welcome to Little Growing Bones. Welcome. So, Judith, today it's a very it's a new topic for me. This topic about a condition called polydactyly is the first time that I've actually come across it. However, I do have experience with it because I've seen certain cases with patients with such conditions. So maybe it would be great if you could just explain what polydactyly is to our viewers, and then we can have the conversation from there.
All right. So polydactyly is the general name for if someone is born with more than 10 digits. So think if the hands and they have more than 5 fingers on one hand, or if it's the toes, then it's called polydactyly. Poly meaning many.
Many, yeah.
Dactyly, digits.
That's obvious. Digits, right? Okay, that's simple enough to understand. And in terms of its background and prevalence, so is it sort of because of genetics, or is it just something to do that maybe it's more prevalent in certain parts of the population?
So it's actually one of the most common conditions, one of the most common I'd even say one of the most common orthopedic conditions.
Right.
And but then how common it is depends on where it's located. So depending on the location is based on whether it's on the thumb side or on the little finger side. So the one on the side of the little finger is extremely common, especially in people of African descent. While the one that is on this side of the thumb side is maybe not that common, but also the one on this side tends to be much easier to treat, while the one on the inner side or on the thumb side is it can sometimes be complex. So if it's on this side, like on the little finger side, it's called axial polydactyly, while on the one on the thumb side is called preaxial polydactyly.
Right. So in terms of its appearance, do you have like a really long extra digit, or is it just like a little digit on the side? How does it actually present when you see the patient? Because I think the ones that I've seen were already being operated on, and I think have the good view to see, how long the extra digit was. Can you see the patient like 6 big fingers or something like that, or is it just a little finger that's showing as well?
Yeah. So the complexity is based on if it is just like a little, like a nubbin, like like a soft tissue continuation. That looks like a finger but doesn't actually have bone in it, or if it actually has bone in it. And if it has bone in it, it's also complicated more by if like that finger is fully formed, that extra finger actually has its own metacarpal. That's metacarpal. I mean the bones in this part, the palm of the hand. So if it's attached to any of the bones in there, then that sort of makes it a little bit more complex. Many times it's just an extra little finger over there, but sometimes it's fully formed. Yeah, and we see the complex kind being mostly the ones that are on this side of the side of the thumb. Yeah, but it can also be extra, but be in the middle, and sometimes it can be extra, but be like combined to the other pre-existing fingers. Yeah.
Okay. So is this something that maybe that can be diagnosed like in prenatal stages of child formation, or is it something that you only see when the child is born, that you can observe that the child has got this condition?
Yeah, so it can be diagnosed prenatally. So with 3D ultrasound these days, you can sort of see most of these things now before the baby is born. But even then, it's still saying immediately the child comes out, because the parents look at the finger and they're like, okay, all fingers present, 1, 2, 3, 4, 10. Oh no, there's an extra. And then sometimes the nurses in the nursery will feed it up and see is it soft or is there like a bony continuity to it? And if they're experts at treating this, and normally if they feel like it's nice, it's nicely soft, they'll just like get it off with like a stitch, and then over time it will follow. Yeah.
Okay. So you've diagnosed the patient, and now the parents come to you to say, okay, I would like my child to be treated. What are the options that you have to treat this patient?
So the options present are the most important thing is function, and the secondary thing is cosmesis, so how the hand appears. And the treatment is normally at the discretion of what of the parents. So some will just be like, take it off right now, and others will be like, no, we don't want it removed, and and then there's that it's not causing any harm, so why take it away? So if it's just attached with a bit of soft tissue, then that can normally just be tied off, and just like how the umbilical cord is clamped when the baby is born and then it falls off a few days later. It's the same thing.
So you're just getting off the supply of blood or whatever is that what you're doing there? Okay.
Yeah. So it will slowly shrivel off and then fall off on its own.
Okay.
Then if it looks like, or if it's examined and there is like bony component in there, then an X-ray is important. And that X-ray helps us just confirm the complexity or where the resection will have to be done from, or how well formed this bone is. Sorry, this extra digit is. So once the X-ray is done and that has been confirmed, then the treatment can be determined. For those post-axial polydactyly, so the ones on the little finger side, they're not an emergency, and so they can be taken off, as late as even 3 years or so. Sometimes 2 years, 3 years, especially if the hand is nicely functional.
Right.
And then that way the child is, old enough to get anesthesia and all those things. Because this is an elective surgery. It's different if it's an emergency surgery. The ones on the side of the thumb are the ones that can be a little bit complex, because the thumb is very important in function, the function of the hand. You want to make sure the thumb is working adequately in the pinch and any kind of grasping. So the reconstruction around anything around the thumb is normally critical, and that's often left to the hand surgeons. So that's mostly around the treatment of polydactyly involved in the hand, but it can be in the toes as well. So if it's in the toes, the considerations around that are: is it painful, and is it affecting footwear? But then also whether there's an aspect of cosmesis. So how does it appear, especially when the children are wearing flip-flops? So, but footwear is where it's most critical, because the feet tend to be slightly wider at the front, and then the children can have a hard time getting shoes that fit, or they could be really squeezed, and they get pressure points, and they get wounds, then get the wound infected, and then the story goes on. So that's something to look at as well, and that that guides a lot in what you can do for the polydactyly in the foot.
Yeah. Okay. Anyway, thanks, Judith. This was really an interesting topic. It's something that I think in my career I've never come across quite often. So as I mentioned, I think it's only 1 or 2 cases where I've seen some reconstruction to digits. So anyway, thanks a lot for watching this channel, Little Growing Bones, as we continue to share different discussions, as we continue to discuss different conditions that affect children in pediatric orthopedics. And we look forward to you joining us in our next episode of Pediatric Orthopedics. And with that said, I would like to ask you to subscribe and share this channel with your friends, family, and anybody else who's interested in the topic of pediatric orthopedics.